Ask an MS Expert Veterans program. My name is Emily Riley, and I'm the moderator for this wonderful program. I'm a proud Air Force wife, dog mom, certified personal trainer who teaches adaptive fitness classes for the MS community, and I've been living with MS for over 17 years. Thank you for joining us. The National MS Society is committed to offering a place to connect and ask questions to MS experts on topics impacting veterans affected by MS. We will also highlight important resources and services available through the VA. MS navigators are online through the program, answering questions and providing resources. So make sure you post any questions or comments that you may have in the comments box on YouTube. I'd like to acknowledge and thank today's national sponsor, Lockheed Martin. Support from MS community partners help the National MS Society reach our goal of providing up-to-date information and support through programs like Ask an MS Expert Veterans Program. Now, establishing and following a treatment plan with your healthcare provider is the best strategy for managing your multiple sclerosis. Medications are used in MS to modify the disease course, treat relapses, and manage symptoms. Today, Dr. Carolyn Bevan will talk about the different types of MS medications, how to access them through the VA, and how to work with your doctor to find the best medication for you. Dr. Bevan is an Assistant Professor of Neurology, specializing in MS and other autoimmune conditions affecting the brain and spinal cord. She is the director of the Jesse Brown VA Medical Center Multiple Sclerosis Regional Center of Excellence in Chicago. Welcome, and thank you so much for being with us today.
It's a pleasure to be here. Thank you so much for having me.
So many studies have shown that early and ongoing treatment with disease-modifying therapies, also known as DMTs, have long-term benefits. So what is the goal of a disease-modifying therapy and why are they so important?
Yeah, so let's just jump into it, right? Get started with a heavy hitter question. So I think to start off on why we talk so much about disease-modifying therapies, it's important to understand what MS is, how it works, and then how the disease-modifying therapies really fit in. So we understand that multiple sclerosis is an autoimmune disease where the immune system engages in this misguided attack on the myelin, the covering of the nerves in the brain and spinal cord. And so depending on where that attack hits, you can have symptoms like blurred vision or vision changes, weakness, numbness, balance problems, bladder problems, all those things that people with MS live with. And so the disease-modifying therapies are really immune therapies. They're medications that are designed to change the way that your immune system works to lower your risk of having these kinds of attacks or keep MS from being active in your body. And so the goal of the disease-modifying therapies really are to reduce risk of having an attack or relapse. They lower your risk of long-term accumulation of disability, and they reduce your likelihood of having new spots on your brain or active spots in your brain, things like that. So that's kind of the goal of being on a disease-modifying therapy in MS.
Great. So we heard from Andrea, who was recently diagnosed with MS, and her MS specialist recommended she start a DMT as soon as possible. So why is early treatment so important?
You know, I always say that I'm better at preventing bad things from happening than I am at trying to fix them once they've already gone wrong. I think our disease-modifying therapies work best at really preventing attacks, preventing MRI changes, preventing disability. They don't necessarily repair things that have already been broken. We don't have those tools, unfortunately. Our body repairs itself, but healing sometimes is incomplete. So sometimes if people have an attack, they don't fully recover. Sometimes people transition to progressive forms of MS, and we don't really have very good tools to reverse that. So I think that we talk about early initiation of therapy as a way to just keep you well, rather than kind of reacting to things that have already gone wrong.
Yeah, so important to be preventative in our care. Now you kind of mentioned a little bit, 4 disease courses have been identified with multiple sclerosis. So we've got clinically isolated syndrome, relapsing remitting MS, primary progressive MS, and secondary progressive MS. So do DMTs treat all 4 types of MS?
It's a good question. So just to set some background, so clinically isolated syndrome is when a person has had an attack that looks kind of like the spectrum of multiple sclerosis, but they don't meet the full criteria for multiple sclerosis. And then relapsing MS is a form of MS where people have episodes of attacks followed by periods where the immune system is more quiet. Now, it doesn't mean that between attacks, people feel perfectly fine. Certainly, people who are living with relapsing MS can have a lot of symptoms even between attacks. And this is the most common kind of MS, especially when people are first diagnosed. And then with relapsing multiple sclerosis, some people with relapsing MS after a period of 10 to 20 years develop a more progressive course where instead of having episodes of inflammation associated with symptoms, they start to develop more of a kind of slow worsening of symptoms over time. And then primary progressive MS is where instead of starting off with having attacks, this slow progression kind of starts at the beginning. So those are the kinds of MS. And it's important to know what kind you have because not all the treatments work the same for all the different kinds. So most of our therapies were developed to treat relapsing forms of multiple sclerosis. And that's kind of where a lot of our measures of efficacy come from. There are a couple like ocrelizumab, Ocrevus, that has been shown to delay progression in people with primary progressive MS. And then siponimod or Mayzent was studied in people with secondary progressive multiple sclerosis. In clinically isolated syndrome, there are a few trials in things like latiramur, the interferons, and teriflunomide in people who have clinically isolated syndrome that show that those medications can delay the time to diagnosis of multiple sclerosis. And it's important to really talk to your doctor about what kind of MS you have, whether you have clinically isolated syndrome, and whether, if so, whether you should be on a treatment or whether you should be monitored. So this is why it's good to have somebody who you can really work with to understand your kind of multiple sclerosis and what might be best for you.
Absolutely. Back when I was diagnosed with MS back in 2005, there were only 4 disease-modifying therapies available, but now there's more than 20 modifying therapies approved by the FDA. Each one having different side effects and risks. So with all these new options, it can feel really overwhelming to choose one. So how do you help your patients kind of narrow their choices?
Yeah, it can be so overwhelming, especially at first. Sometimes, someone is newly diagnosed and dealing with that, and then also having to make these big, confusing decisions about all these medications with fancy names that sound like cheeses. I don't know where they come from with these things. But yeah, so I think it's all about shared decision making. So working with a doctor who you really feel like listens to you and tries to understand, your unique circumstances, your goals, and what would be the right thing for you. Because now that we have all of these options, we can really tailor treatment to the individual rather than just, well, this is your only choice, so here you go. So I think a few things that I try to do. Number one, you're right that there are so many different disease-modifying therapies. There are 9 categories of disease-modifying therapy. So sometimes I kind of break it down a little bit into kind of lump them into the different categories. So at least you can kind of get a sense of, okay, everything in this group has the same way of working and the same risks and side effects and things like that. So simplify it a little bit if possible. And then I also think about what does your MS look like? What treatments have you already tried? How are you doing? Are you minimally symptomatic? Is your MRI looking great? Do you have more lesions? Did you have some tough time recovering from attacks? Do you have progressive MS? And then also kind of what are your life plans? Like, are you having a family in the next couple of years? Do we need to think about that when we start thinking about your treatment? Are you terrified of needles? Do you want to get an injection every once in a while versus are you more comfortable with pills? So I think that explaining the risks and the benefits and where you feel comfortable and what your MS is looking like, I think can kind of come together to choose the right therapy for you.
I love that. Yeah, I know we'll talk a little bit more about making sure people stay compliant, but I'm sure all those things help, if it's really tailored to what they're interested in. So now we know that all medications have side effects, and I know we don't have time to go through each disease modifying therapy, but can you tell us some of the monitoring or safety tests that are done to help mitigate some of the risks and limit side effects?
Yeah. So I think you're right that this is a conversation that's really tailored to which treatment you're on, because they all have really unique ways of working, and that those kind of how they work comes with certain risks and side effects. But kind of to simplify things, first there's kind of the screenings that we do before starting a disease modifying therapy. So screening for certain infections, making sure that you have the vaccines that you might need to have before starting a therapy. And then there are certain drugs where there are other tests like eye tests and heart tests and other things that you may need to have before starting the treatment. So screening first, just to make sure it's safe. And then, if you do need to get your vaccines, there's certain timing and other considerations there. And then after that, there's the monitoring period. And monitoring is kind of two things. One is monitoring for efficacy, meaning is the drug working the way that it should? And we have some measures that allow us to kind of look into that. The one most important, of course, is how are you doing, right? And so seeing your doctor, letting your doctor know about whether you're having any symptoms, having your doctor do a thorough neurologic exam and making sure that you're looking good and things are stable there, that's really important. And then we also have MRIs. We are all familiar with MRIs and MS. We get them a lot. And that's another way of us checking in and making sure that things are working. So efficacy is important to monitor to make sure things are doing what they should. And then there's safety. So each drug has its own risks. And so we do certain blood tests or other monitoring over time after you start a treatment to make sure that it's safe and continues to be safe, so that we don't need to make any changes there.
Great. So Paul's been on his DMT for 6 months and he doesn't feel any different. How does someone know if the disease modifying therapy they choose is working for them? And if it isn't working, what are their options?
Yeah, good question. So I think in general, the disease modifying therapies all have a more preventive role when it comes to MS. And that can be tough because you wonder sometimes, is it working or not working? So I think that we define efficacy when we think about the disease modifying therapies as no relapses, no progression of disability, no newer active lesions in the MRI. But as we've talked about, people with MS live with a lot of symptoms, and the MS disease modifying therapies don't necessarily help with the symptoms you already have. If you're recovering from an attack, sometimes some of the disease modifying therapies can kind of help that recovery. There are certain MS medications where some people observe that they feel better after just getting on a therapy, getting that inflammation down in their bodies. There's this concept of clinically definite improvement, which some trials have shown that certain disease modifying therapies achieve that goal. But most of them really just prevent new things from happening. And so we're left kind of trying to address other symptoms in other ways. So I think it's important to talk to your doctor if you're still feeling symptoms to understand why that is, whether it's because you're having active inflammation or whether it's because of other stuff that the MS medicine isn't really supposed to help, and we need to do other things to help with those symptoms.
Okay, that's helpful. So we heard from Lindsay, who's wondering if an injectable DMT is stronger than an oral medication. Do we know that? And is that true?
Yeah, it's kind of recently we've come into a time frame when what's old is new again. So the very first treatments that came out for relapsing multiple sclerosis back in the early 90s were the injectable disease modifying therapies like interferons and glutaminyl acetate. So things like Rebif and Avonex and Copaxone and these kinds of medications. We had those for a long time. Now we have obviously many more of them. And so we think sometimes of the injectables as like, oh, that's the old stuff that's not as effective as the new stuff. But in fact, now we have an injectable medication called Kesimpta or ofatumumab that is actually one of our most highly effective disease modifying therapies. So that just is probably one of our newest entrants to the MS market. And so now we can't really lump things by injectable oral infusion, which are the kind of three modes of delivery. So we really just have to look at each medication individually rather than classifying it only by how it's given.
That's a really helpful perspective to think about. Angela wrote to say that she's been on the same DMT for the last 8 years and hasn't had any relapses. Yay. But she's getting tired of giving herself injections and is considering switching to a pill. she's worried about rocking the boat, even though she's been doing really well. What advice do you have for Angela?
Yeah, so injection fatigue is real. It definitely gets tiring. People get scar tissue that accumulates, and sometimes certain medications can be associated with flu-like symptoms that kind of get old. So there are a lot of things that come along with injection. So first thing to think about, if you're otherwise really comfortable with your medication, is am I doing everything I can to address the side effects I'm having from my injection? So for example, if it's pain at the injection site, can I use things like topical lidocaine or Benadryl to kind of address some of those site reactions? If it's flu-like symptoms, am I timing my, my Tylenol or my Advil along with my injections, and what time of day am I giving my injections? And then also know that among the injections, there are a lot of different timings. So certain injections are given more frequently than others. So if you kind of want to stay in that class, you can sort of choose an injectable that's not given as frequently, perhaps. And that would be kind of like a half step over. But then, if you're sick of it, we have a lot of options that may not have even been available 8 years ago. And so it's just time to talk to your neurologist and say, hey, I'm kind of getting sick of this. What else is out there? And that's a long conversation, fortunately, because there are a lot of things that are out there that you can switch to that are either as effective, more effective. So, kind of think about other options there.
Yeah. So going off of Angela's question, like, are there safeguards or ways to keep people safe from relapse when switching to a disease modifying therapy? Is there like timing you have to be aware of?
Mm-hmm. Yeah. For most treatments, we don't do big washouts where you have to be off of something for a really long time and get it out of your body before starting something else. And the reason that we don't usually wash out like that is because we don't want to wait for a relapse. Certain medications like Tecfidera, for example, leave your body very quickly. And then other medications like Aubagio stay in your body for a really long time unless you take something to get rid of it. So they all kind of stay in your body for different amounts of time. And we don't necessarily wait for them to leave unless there's something we're concerned about, like a low white blood cell count or something like that we have to wait for that to get back to normal. Other medications like Tysabri or Gilenya, so natalizumab or fingolimod, are actually associated with rebound relapses after discontinuation. So those we really don't wash out. We really just kind of get you transitioned to a new disease-modifying therapy quickly so that we can lower the risk of having an attack during that transition period.
It's really helpful. So how long does someone need to take a DMT? Like, is there ever like a safe time to stop? Or we wouldn't need it anymore?
That's a great question. And it's one that we're really actively researching. So there's not a clear answer of whether it's ever okay to stop. We have looked at, let's say, starting in a highly effective medicine and then switching to one that's kind of less effective, but maybe safer, for example. And it doesn't really seem like that works out so well all the time. People can go back to having more relapses if they kind of change their medication around a little bit or stop their medication altogether. There are certain scenarios where stopping may be a good idea. So, for example, if people start to develop more frequent infections, meaning that their immune system might be a little bit too low, sometimes we stop medication. Also, in people 65 and older, sometimes there's a cutoff there where your likelihood of having a new attack reduces. And so, and the risk of infections from being on an immune modulatory medication may increase. And so that's a time when sometimes we can talk about stopping altogether. It's because these medications are preventive, it can feel like, why am I taking this if I'm fine, right? Like if I'm doing well, everything's stable, my MRI is stable, like maybe I don't need it. Mm-hmm. It doesn't seem like these are truly cures where being on the medication for a little while means you'll never have an attack again once you stop it. So if you're off of a medication, you could have more disease activity. So we don't really have a clear answer about when it's okay to stop.
Yeah. I remember when I was first diagnosed, my neurologist told me, Emily, like, what you do today will benefit you 20 years from now, and really having that like long-term kind of perspective was just helpful on those days that I didn't want to, take the medication for whatever reason, just remind myself that long-term perspective.
That's such a good point. I think that, MS is unpredictable. So you can feel well one day and then have an attack the next day, but also you can have a great introduction to MS the first couple of years, and then things get more rough down the line. And so there's kind of the short-term unpredictability, and there's also the long-term unpredictability. And that's why we do tend to keep people on treatment for the long term.
Yeah. So now that we have so many MS medications available, I'm really excited and hopeful of what's to come. So will research continue for new therapies? And is there anything exciting or new on the horizon?
Yeah, so we continue to have new entrants to the market for mostly relapsing multiple sclerosis. There's a new category of kind of a new mechanism of action, disease modifying therapy group that are probably going to hit the market in the next few years. I think that the more exciting stuff to me is filling gaps where we still need help. So a lot of research is being done to find better treatments for progressive forms of multiple sclerosis. I don't have any huge breakthroughs coming out tomorrow, unfortunately, on that, but so much work is being done on progressive forms of MS. And then also the remyelination and repair strategy. So some early data there that has been promising. And I think growing research and growing hope that we're going to find that thing that reverses the damage rather than just preventing things from happening. I think that's such a need. And then another area that I find really interesting is the neuromodulation stuff. So like devices for MS. So things like kind of stimulating devices that help kind of with the MS nervous damage. So helping signals get down and repairing people's limbs that can't move. And so there's a lot of cool devices out there right now, like Pons and is one of them. And there's a wearable for your leg that helps your leg kind of move better. And a lot of interesting stuff. So I think that's another new frontier that's out there.
Yeah. You mentioned this a little bit earlier, but there are clinical trials underway evaluating if early and aggressive treatment of MS with DMTs is more effective in the long term than this gradual escalation to a stronger treatment over time. So what can you tell our viewers about these two different approaches to DMTs?
Yeah, so first kind of defining what we mean by high efficacy. So most of this really refers to the relapsing forms of MS. And the highly effective disease modifying therapies kind of look at the reduction in the risk of having relapses. So for example, the early injectable medications like the interferon beta and glatiramer, Adhere, which is teriflunomide, they lower your risk of having an attack by about 30%, versus things like natalizumab, ocrelizumab, ofatumumab. So this is Tysabri, Ocrevus, Kesimpta, also alemtuzumab is on that list. They reduce your risk of having an attack by 70% or more. So there's quite a span of efficacy of the disease modifying therapies. So when we talk about different approaches, I think what used to be the predominant approach is that we start on one of the more modestly effective disease modifying therapies, and then we escalate, meaning kind of choose a more highly effective therapy if the low efficacy one doesn't work. So if you have a breakthrough relapse, or if your MRI shows new changes, then we would say, okay, this didn't work for you, then we have to increase the efficacy. So that's kind of the escalation approach to therapy. I think as we have more options now for treatment, we have highly effective disease modifying therapies that have a reasonably good risk profile. I think we're starting to offer treatment with a highly effective therapy earlier in disease for a few reasons. One is that we know that relapses are really underreported. And so sometimes people will have a symptom, maybe they will kind of not really think it's anything they should tell their doctor about, and then we find out later that happened. We know that there's subclinical disease activity, meaning stuff is happening under the surface that we're not always very good at measuring. For example, we're not good at measuring cognitive changes over time. It's slow, it happens slowly, it kind of creeps up on us. And by the time it's really a problem, you kind of wish you had realized it like a long time ago. We don't have good clinical measures of brain atrophy, which is probably an important marker for long-term outcomes and disability. So there's a lot happening beneath the surface that we just don't really measure very well from year to year. And we also know that people respond best to the highly effective therapies or to any therapy early in disease with less disability when they're younger. So we know that kind of earlier starts, probably that's where you have the most benefit from these treatments. And so that's why we've really started to look at early initiation to prevent some of these things, rather than just assuming, oh, we'll catch it if things go wrong, and then we'll escalate when it's not clear that the benefit of those highly effective therapies is even going to be as robust.
Yeah. So we heard from Amani, who said that she's trying to make a therapy decision and read that a Black person with MS should be put on a high efficacy therapy first. So does race play a role in the effectiveness of certain therapies for MS?
Yeah, historically, people of color were not well represented in the trials for our disease-modifying therapy. So we are lacking data on the relative or comparative efficacy in these treatments on people of color. But there are some trials and some analyses that have looked at this, and it does seem like certain therapies don't work as well in people who have African American ancestry. And it also seems like MS tends to be more aggressive in people who are Black or brown. And so it seems like we should be treating more aggressively in people who are Black. And so I would agree. I tend to recommend for my patients who are African American that they start with a high potency disease modifying therapy. That being said, it gets back to every individual is unique. And so we can make certain blanket statements about certain groups. But I think it comes down to also looking at each individual, how their MS is looking and what's right for them.
Well, that is a great segue into our next topic, which is kind of partnering with your healthcare provider. The decision to take a disease-modifying therapy should be a shared decision made jointly between you and your healthcare provider. And like you said, each person's body or disease can respond to DMTs really differently, and the treatment that's a best option for one person may not be for another. So let's talk a little bit about some of the different factors that if a patient and their healthcare provider would discuss about the disease-modifying medications. So if a healthcare provider isn't accustomed to including a patient in treatment decisions, how can someone advocate for themselves to be a part of the conversation?
Yeah, super important to feel like you have a connection with your doctor, because this is going to be a lifelong relationship, right? And so if you're not really feeling that connection, just think about that, because you're going to be working with that person pretty closely for a while on some important stuff. So really need to feel comfortable. I think one thing is that there is a limit to the amount of time that we get to spend with each other in a clinic visit. And so I think sometimes it takes a few different visits to really feel like you have the adequate time to ask the questions that you want to ask. One thing that I usually do is kind of start the conversation, give the kind of general outline of things, and then send people with good resources, good reading material to kind of try to educate yourself a little bit about what's out there and what disease-modifying therapies are available. Time to talk to your family, time to talk to friends or people who may have multiple sclerosis, just to get other perspectives, then come back again and have a more detailed conversation after, you've kind of wrapped your head a little bit around this. But if you really feel like you're not getting good information from your doctor, you really maybe should consider talking to an MS specialist, seeing if someone really, because this is an area where, because there are so many advances in treatment, sometimes general neurologists or people who are not specialists in multiple sclerosis may just not be as aware of all the different options that are out there. So if you don't feel like you have that connection, maybe you look for someone you really can feel that connection with.
Yeah, no, I think it's important for us patients to feel empowered to be a part of the conversation. So That's really helpful. So the disease-modifying medications are designed for long-term use, and it's important that people take their medication as prescribed to them in order for it to work correctly. However, a lot of people stop their medication for a variety of reasons, like they're not feeling any better, bad side effects, they forget to take it, they can't get off work for an infusion, or like a lot of people, they can't afford the medication. So can you talk to us a little bit about the importance of adhering to your medication schedule and what are the risks if you don't?
Yeah. I think I wish that every person could start a therapy and it just goes so well and everything is perfect all the time. But that just isn't the case. And sometimes it's a little bit of a trial and error to find the treatment that's right for you. And so if you're having side effects, if you're not feeling like this is the right treatment for you, then reach out and tell your doctor. I know that sometimes you feel like, oh, I just don't want to deal with it. But your doctor is your partner. And so just let your doctor know what's going on. I think that the reason that it's important to stay on your disease modifying therapy is really because they only work if you take them. They don't really work if they're sitting in your medicine cabinet. Some of them, like we've said, take some time to get out of your body. And so you'll have a little bit of a window of time when you can kind of reach out and let your doctor know. Some of them, they'll leave very quickly. So even a few missed doses can really impact the efficacy of the medication. Others, if you kind of stop it and then restart it, there are certain risks that kind of come up because, for example, with Gilenya, when we first start the medication, we have to monitor your heart because it can lower your heart rate. So if you stop it for a while and then say, oh, I'm going to go back and take it again, that could actually be pretty risky. Because we would need to monitor that heart rate again if you've been off it for a while. Oh. And then other medications, like we've said, Gilenya and anti-Sabri can be associated with rebound relapses if you stop it, especially if you stop it and don't then immediately transition to something else. So a lot can happen if you're kind of doing a stop-start or delaying certain things. So definitely work with your doctor.
Yeah, because Lee wrote in and said that they didn't feel like their DMT was working, so they stopped taking it, but they didn't want to tell their doctor because they knew they would probably get lectured. So kind of similar to what you said, you shared a little bit about the risks of stopping DMTs without working with your doctor. So that's definitely something to be cautious of, right?
Yeah. And I totally get that. I wish that I could say that we're all doctors are such angels and we'll just be so warm and open about hearing that you're not taking your medicine. But please tell your doctor if you get some kind of response that's not the warm and welcoming response that you wish, then think about that relationship a little bit. Because I think honestly, all of us just want what's best for our patients. And I think that if you're not taking a medication, there's a reason for it. Whether it's because it's not the right medication for you convenience-wise, it doesn't fit with your life, in which case we should think of something else if it's causing side effects. I mean, the goal for us is really to get you on the medication that fits in your life. And so if this medicine isn't fitting, then we have to find one that is. So it's just a matter of finding the right treatment.
Yeah. So what about people who have like comorbid conditions or risk factors, such as like type 2 diabetes or cardiovascular risks? I'm assuming that these should be also considered in their MS therapy decision.
Yeah, definitely important to tell your doctor about any health history that you may have. There are certain chronic infections that we would need to know about before starting a medication. Certain other conditions like diabetes and heart disease can raise certain risks with certain medications. And it's also just really important for your doctor to understand everything that's going on in your body, not only just because it impacts the treatment choices, but also helps us understand why you may be having certain symptoms. So yeah, definitely disclose all of the other stuff that is going on with your health.
Yeah. So preventing infections through vaccine is on everyone's mind lately, and experts from the American Academy of Neurology recommend that people with MS should receive vaccines according to standard vaccine guidelines. So can you talk to us about the safety of vaccines for people with MS?
Yeah, so you're right that in general, we recommend vaccines for people with multiple sclerosis. Certain medications, vaccines need to be timed with certain medications. So if you're about to start a medication, you should be thinking about what vaccines you may need to take before starting a medication. There are some limitations about receiving live vaccines, either with multiple sclerosis in general, or especially on certain disease-modifying therapies. But because these disease-modifying therapies do affect your immune system, it's even more important to protect yourself from getting infections. And vaccines are a really important way that we can do that.
Great. So I know we talked about the purpose of disease-modifying therapies for more like preventative, like long-term perspective. But as you mentioned, like, people living with MS still experience symptoms on a daily basis. And so in addition to treating with disease-modifying therapies, there are some day-to-day symptoms that can also be treated with medications. So what are some of the MS symptoms that can be treated with symptom management medications?
So I know we're talking about drugs today, meds and drugs, but I always start by taking a step back, thinking about a symptom and a person experiencing that symptom more holistically, because a lot of the times we can start with diet changes, lifestyle changes, or understanding what could be causing a certain symptom. For example, fatigue. So someone may come in saying that, hey, I feel tired all day long. And there are medications that can help with fatigue. But then if you ask more questions, you find out that person is not sleeping all night because their bladder keeps waking them up all night long. So maybe if I treat the bladder problem, they'll sleep better and then they'll feel more awake during the day. Or maybe they have sleep apnea, or maybe their fatigue is because their thyroid's off or their B12 is super low. So there are a whole bunch of other things that I usually start with first to try to fix, because sometimes symptom treatments can be a Band-Aid on a problem that really we need to address the underlying cause rather than just slapping a Band-Aid on it. So fortunately, we have a lot of treatment options for symptoms, things like pain and spasticity, which is like a muscle stiffness, bladder problems, fatigue. So there are a lot of treatments out there. There's even a medication called dalfampridine, which can help people walk better with multiple sclerosis. So lots of stuff that we have, lots of tools in our toolbox, but we have to kind of think more comprehensively. Are you kind of putting a bunch of junk in your body with bad food choices? Are you just not exercising, being sedentary? And are there other things that we can do to really help optimize how you're feeling first before we add a new medication to that med list?
Yeah, I know I've had the experience of like trying a symptom management medication, which then caused other side effects. So it really wasn't worth it. But then others really changed my quality of life and was really thankful for it. But as a fitness professional, I also appreciate your holistic approach of just like, what are some non-pharmacological things can we incorporate to help mitigate some of those symptoms? So
definitely,
it's helpful. How do you know when it's time to use a medication to treat a symptom? And is it safe to take these medications with a disease-modifying therapy?
Yeah. So I think that, if you've gone through kind of the lifestyle changes and kind of the looking for underlying causes and the symptom has been persistent, then I think it's really reasonable to talk to your doctor about what medications there are out there to help, especially if it's really getting in the way of your quality of life.
Yeah.
So sometimes we doctors identify symptoms just by asking questionnaires and things like that. But if it doesn't really bother you, we don't necessarily have to treat it with a medication. But certainly if it's getting in your way, yeah, we should do something about it. And most of the medications that we use for symptom management are okay to take with your MS medications. But I think it's always important to tell your doctor not only what MS medication you take, but also all the other medications you take, because there are a lot of interactions that can happen. So just important to disclose everything you take, including supplements, because that can help us choose a safe medication for you.
Great. We're going to kind of shift gears a little bit and talk about access to MS medications and the different VA resources. So in 2003, the Department of Veterans Affairs established the VA MS Centers of Excellence. These centers collaborate with VA providers to make sure that veterans get the best care possible and have access to the various resources available within the VA. So tell us how the MS Centers of Excellence work and how does someone find out if there's one near them?
Yeah, so the MS Centers of Excellence are basically a network of MS specialty care centers around the country. So there are two kind of we kind of split the country in half. So there's an east and a west one. And then in each VISN, there's at least one regional center, and then there are support centers. So there's kind of a big web of MS care all over the country. And every VISN has at least one regional center of excellence. So these centers of excellence have MS expertise. They have specialists in rehabilitation, social workers, and other kind of access to treatments and specialty around giving medications and things like that. So it's important that that we all kind of collaborate together and provide those specialty services to veterans living with MS.
That's great. Veterans with MS, they may be eligible for VAs, like many programs and services. So access to VA healthcare is based upon enrollment eligibility and discharge status from active duty military service. So what does medical care for eligible veterans with MS include?
So specialty evaluation, so community care, virtual care options. There are consultations through access to the MS Centers of Excellence. There's also, we've talked about the disease-modifying therapies that are covered through the VA. The vast majority of them are medications for symptoms, physical occupational therapy, and then a lot of other health services. I know at my VA, we have access to complementary and alternative treatments like acupuncture, massage therapies, a lot of options that are covered through the VA. So you may be surprised what you have access to through the VA. So it's really good to check.
Yeah. I know you mentioned that disease-modifying therapies are included for eligible veterans. About 31% of veterans with MS live in rural areas. So how do people living in rural areas access their medications if they're not near a VA?
That's a good question. So fortunately, we have growing access to virtual care through the VA. And so sometimes if you live far away from an area of subspecialty, maybe you can make a trip every once in a while to be seen in person, but the rest of your care can be provided virtually so that you can still have access to that specialist. There also is an option for community care referral. So if you really just have no access to anybody in the VA, you are eligible to see somebody in the community and have that be covered. And then there's also that e-consult that I mentioned, where the MS Centers of Excellence has support for your physician. So if your physician is not as familiar with the process of, for example, getting you on a disease-modifying therapy, your care provider can actually send a consult to the MS Centers of Excellence, and they can provide guidance and support. Medications can be mailed to your home, so you don't have to live near a pharmacy and go pick up your medications in person. And then also, we do think about logistics as we choose a disease-modifying therapy. So, if you don't live somewhere near an infusion center, then maybe we should avoid some of the infusions or put you on an infusion that's less frequent, so you don't have to travel as often. So there are different ways that we can still provide care to people living with MS in rural areas.
That's great. So we heard from Charlie, who said he's already enrolled in medical care, but finds that navigating the large and complex range of VA benefits and grants can be kind of confusing. Are there VA staff to help him?
Yeah, absolutely. So I think start with your primary care, because a lot of time your primary care is part of a team and has access to different resources that can help you navigate that. But also your MS specialist should be able to help you as well. And then many times different MS centers work with MS social workers who can help give you advice about navigating the system. If you don't know your benefits, there is something called VSO, Veterans Service Organization, that can also help you. And if you are not enrolled, you can apply for healthcare at VA Benefits and Healthcare. I think the website is included here. So important to know your eligibility for certain benefits.
Absolutely. It sounds like you all have a lot of really great resources that they can tap into, for sure. Many people living with MS can't access the medications they need due to high and escalating medication prices. The financial burden due to out-of-pocket costs and challenges navigating the healthcare system. So what are some of the resources that people living with MS what kind of resources do you have with medication prices and adhering to their treatment plan?
Yeah, first, I just want to acknowledge what a real problem this can be. These medications are terribly expensive. And I think in a larger sense, this is something that we as a profession are really advocating for, affordable medications for our patients, but it's definitely a work in progress.
Mm-hmm.
So the pharmaceutical companies and manufacturers do offer patient assistance programs for out-of-pocket costs for medications, especially for the disease-modifying therapies. So it's a good idea to reach out to the manufacturer if you are experiencing some out-of-pocket costs associated with your treatment. The National MS Society also has navigators and benefits and employment that can be really helpful. And then there's also other resources like the Paralyzed Veterans of America, who have some support resources. There are other kinds of online resources like GoodRx that can help, especially with some of the symptomatic medications that you may use to treat your, the fatigue, the bladder, these kinds of things that can still kind of cause some of these out-of-pocket costs. So there are some resources there that you should definitely take advantage of.
Yeah. The National MS Society partners with the Department of Veterans Affairs, MS Centers of Excellence, and the Paralyzed Veterans of America to improve care and expand resources for veterans living with multiple sclerosis and their families. The National MS Society has several resources to help veterans living with MS. Can you tell us a little bit about some of those?
Yeah, so there's the MS Navigator program that you can reach out to, or your physician or your care provider can actually refer you to an MS Navigator just to kind of help you become aware of all the different options that are available to you, and also for caregivers. And then there's this Ask an MS Expert Veterans program, which is a good resource as well. And that takes place 4 times a year, and it can be found on the Society's website or YouTube channel. So those are really helpful.
Yeah. In addition to those, does the National MS Society have any self-help or support groups for veterans living with MS?
Yeah, so there are support groups, connections programs like self-help groups. National MS Society has a Facebook page, and there's a group just for veterans and active duty military. And also, if you would like to get involved, you can go to the Society's website, which will put you in touch with a lot of different resources to connect with people living with MS.
That's so great. Yeah, I think it's really important for us to be able to talk with others with shared experience, not only living with MS, but also being a veteran living with MS. I think probably has its own set of unique challenges. So I think those are really great resources people should definitely take advantage of.
Absolutely.
Well, Dr. Bevan, thank you so much for sharing such valuable information today. Now, I know we've been given a lot of information, so I want to ask you to share maybe your 3 top takeaway messages that people can use today. If they didn't hear anything, what are the 3 things that you hope that they take away?
Yeah, so I think one thing is to work with your doctor to really develop a comprehensive treatment plan. And the disease modifying therapy is an important part of that plan, but it's not the whole thing. So just find somebody that you really feel like is a partner in your care. Then stay up to date with safety and monitoring. So, I think the first part of it is making that decision about what your disease modifying therapy is going to be and what your treatment plan is, but then keep up with it. Don't, check in, let your doctor know what's going on. If you're having difficulties navigating, reach out. I think lastly, reach out for help. So if things aren't going well, if you're confused, if you're lost, if you're not feeling like you can navigate this large system, then ask for help. There are resources available both through your care provider, your physician, but also we've talked about the MS Society and the Paralyzed Veterans of America. And there are a lot of great organizations that can really help and advocate for you if you're having a really hard time being heard. Mm-hmm. I think I always like to end just with hope. I think the other thing is that thinking about where we've come from, having no MS disease modifying therapies before the early 90s to having 20 disease modifying therapies now, and having so much excitement on the horizon around remyelination, repair, treatments for progressive MS. If you don't feel like you have the right treatment now, just wait. Because I think we just have always more around the corner. So I just want to end with that message.
I love that. Well, thank you so much for being with us today and sharing such valuable information. I feel like I'm really hoping that people come away feeling empowered, knowing that they do get to be a part of this conversation, and that there is hope for the future. So thank you so much for your time.
Absolutely. Thank you.
Before we close, I'd like to remind everyone that you can connect with an MS Navigator via phone, email, and through the Society's website via chat. For information and resources on MS, visit the Society's website. You'll find research updates, news, self-help groups just for veterans and active duty military, more ways to get involved, and upcoming events near you. To learn more about veterans and MS, visit www.nationalmssociety.org/veterans. You can connect with the National MS Society and others affected by MS via Facebook, Instagram, Twitter, YouTube, and LinkedIn. I encourage you to like or get on, subscribe, or get on the Society's mailing list to continue to receive up-to-date information on MS and updates or upcoming programs. Thank you again, Dr. Bevan, for sharing your knowledge and for everyone's engagement in today's program. The recording will be made available on the Society's website at www.nationalmssociety.org/MS-expert. It's important to get your feedback on today's program. You'll see a survey linked to the comment section on YouTube. Completing this survey makes a difference, and it only takes 1 minute. So the information you provide helps continuously improve and shape future segments. Thank you so much for joining us. See you soon.